Hello, my name is Rachel Delgado. I work for Great Lakes Bay Health Center WIC Clinic here in Saginaw, Michigan. I am a breastfeeding peer counselor and have been for almost 3 years now. I am the mother of 6, and all my kids range from the year of 1 to 16, so definitely pretty big household. I have been and still am a WIC participant with all my kiddos. So today what we will do is go over some breastfeeding basics, and I use the Coffective platform to go over that. So if you were to come into clinic, this is what we would have went over. So I am just going to, let me enlarge myself a little bit and scooch myself over there. So here goes nothing. So definitely building your team is very, very important. Having people that surround you that are supportive of breastfeeding. If you have a friend who has breastfed, coworker, or somebody in your family has breastfed, definitely a good go-to resource. And you don't have to have somebody who has breastfed, or, just having, somebody that supports you in your journey, and making the plan is definitely half the battle. So doing some research, some education, and that can definitely make a world of difference. So, and that is called your getting prepared. So definitely, if I am sending you this video, you're pretty close to that due date. So baby will be here soon. And then, here at WIC, we do offer, peer counselors at most clinics. So definitely reach out. And most clinics do have board certified lactation consultants as well. So, if there is, other stipulations that might be outside my scope, definitely an IBCLC referral would be given. And then the food packages for breastfeeding moms is quite a bit bigger. So that's, one of the perks of being a breastfeeder. Your nutrition is very important. What you consume, baby gets. So yeah, definitely. The breastfeeding food package is quite a bit bigger. Like I said, we can provide that breastfeeding info and help with latching, IBCLCs on site. So whatever, we can definitely help you at WIC. Peer counselors, most clinics do have peer counselors. And breast pumps are covered 100% by insurance, but say some reason your insurance didn't cover one, or you had already had a breast pump with a previous kid and they won't cover another one, we can help you here at WIC. We do have, hand pumps. Even if you get your electric one through insurance, we can definitely help you with a hand pump. And the couple that we give are, this is a Philips Avent. Pretty easy peasy. And then this is a Harmony that we have. So yeah, we definitely have some good options. And then, so getting ready, let labor beginning on its own, if possible. It's not always the case. Every pregnancy, every, breastfeeding experience is very different from one kid to the next. So I'm just having that plan in place, and know that, it might not go exactly as you would like, but maybe it could. And just having that plan in place really does make a world of difference. So what are you comfortable with, pain medication wise, and if you just want a natural birth, kind of all them things to take in consideration. Talk to your OB about that for sure. Baby continues to grow, through them last week. So even though we are really ready for labor to get over with and see our baby will continue to grow, even in them last week. So 36 weeks, the baby is still growing and gaining weight. 37 weeks, the brain, lungs, liver are still developing. 38, baby's toenails reach the end of his toes. His organs are still developing. 39 weeks, baby's brain is still developing. And week 40, baby's ready, maybe. For my kiddos, I had to get induced and did go to 41 weeks. So it can definitely go beyond 40 weeks for sure. My picture down here. And then just, kind of thinking about, okay, what am I prepared for, relaxation wise, what, keep in mind, what makes you comfortable. The hospital isn't home. And so if you are going to a hospital to birth, kind of taking some comforts of home can, make you feel a little more relaxed, whether it be, just having your phone, a book. Yeah, definitely, take something from home with you so you feel a little more comfortable. Massage definitely makes a world of difference. It kind of distracts your mind from them contractions and using them breathing tools. Keep moving. That definitely, keeps labor going. And you can talk to the wherever you will be giving birth at, about water births, if they do them or not, and if you could have, a water birth. If I could go back, I think, looking back, I think that'd be something I would have liked. So I'm just kind of keeping all them options opened. And fall in love. So this is my favorite part, and this is when your baby comes out and you first see your baby, and it's euphoric. It is. There's no words to describe that moment. So definitely, seeing your baby, you will definitely fall in love. And that first hour to-do list, very, very important, skin to skin. And what skin to skin does is give that baby the security. They're safe, they're sound, they're with mom. Baby knows the rhythm of your heart, the smell of your skin. Mom's chest is baby's nest. And that's really, where baby wants to be and where baby belongs. That's where the food is. So definitely putting baby skin to skin will help them to awake and kind of catch their bearings and look around and talk to baby. Let them know that they're safe, they're sound, they're with mom. Babies know your voice. They've heard it, for the last 9 months. So, and really enjoy that first hour. And one of the first signs you'll see that a baby is ready to nurse is that rooting reflex. So kind of bobbing around, moving around the chest. And then just watch for a nice latch, nice flanged lips, suction cup seal is what we aim for. And it does take some practice, it is a learned technique, and every time at the breast will give that baby that learning experience as well as mom, So, and then just feed on demand and delay any procedures. Weight checks, vital signs, all that is secondary to skin and breastfeeding unless it's a medical emergency. So I would definitely, skin to skin is one I would definitely put in my birthing plan. And I always did for all my kids. So. Then some of the benefits of that skin to skin is it warms baby, keeps them nice and cozy, stabilizes the blood sugar, and it lowers your pain. When you look at your baby, there, you'll have a placenta coming out and you don't even realize that you're just looking at awe of that baby. And definitely that'll really help that oxytocin and help that milk production for sure. So, and prolactin and oxytocin, them are some hormones that really, get that milk flowing and going. So, and having your baby in your arms, just, man, nothing like it. And so, and just in case you do have a C-section, definitely, skin to skin's not out of the option. I would talk to the hospital and see what their procedures are, but I would definitely let them know, like, hey, this is something I really want to do. And it might be only for a moment, where they'll take you away, get you stitched up, and then you'll be back with baby. But definitely talk to whoever's with you, because baby can do skin to skin with, dad, grandma, whoever is with, you in your labor. And so that way, baby has that skin-to-skin contact. That person has a heartbeat. That person has skin, has warmth. And then when you come back, oh yeah, baby's going to be ready to eat. So definitely that'll prep baby. And let's see, so that journey to the breast can take a minute. So just lots of skin to skin, and it can take up to an hour for baby to really catch them bearings and be like, oh yeah, where's breast? And just watch for that good latch. And definitely keep baby close. So again, skin to skin, oh yeah. And so I just like looking at all the pictures. And then visitors. So depending on, who you are, you might want a lot of people. Some people are comfortable with that. Remember, you just had a baby, so you will be bleeding, and with breastfeeding, you want baby with unlimited time at the breast. So for sure, you want to be comfortable. So do you want a lot of visitors? Not so much. So, talk to your significant other or whoever might be with you in the hospital about, hey, maybe delaying visitors until you get home, unless that's what you want. So, but just know, with a lot of people, it can be, lots of interruptions for breastfeeding. You really want baby with unlimited time at the breast. And let's see, keep close. So really learn your baby. Watching them feeding cues for sure. Hands in the mouth. Oh yeah, baby's hungry. So really staying close at bedside. And baby's moving around, kicking around. Eyes are closed, but if a baby's moving, definitely put baby to breast. Active cues, hands in the mouth. Oh yeah. And something I like about this picture is this baby isn't swaddled, and definitely swaddling has its place. It can really calm baby, but too much, it makes them feel like they're back in the womb. So kind of, that open, unrestricted time on the chest, that skin to skin can really, help mom with that milk production. The first 2 weeks after delivery are very important for stimulation, and your supply it is really determined by that stimulation the first couple weeks. So you want baby to have unlimited time at the breast, just nursing on demand. If you're really engorged, you can use your pump to really pull a little bit of extra milk out before latching, kind of soften the breast, and that'll make it easier for baby to latch. Imagine like bowling balls and being really hard and stiff. It's going to be hard for baby to get a good deep latch on breast when it's really tight and compressed. So using, if you have a hand pump or, your electric pump, just, squeezing a little bit of milk out beforehand, getting that flow started, softening that breast will make it easier for baby to get a good deep latch. For sure. And let's see how often to breastfeed. 8 or more in 24 is the general rule. Just definitely on demand. Watch them feeding cues, very important. Make sure you're alternating breast. If you start on the right side, make sure the next feeding you're going to go to the left side, and make sure you if baby wants, definitely offer both sides at one feeding. And let's see what else. Then feeding cues, how often. The first milk is called that colostrum, that colostrum. Definitely very thick, power-packed milk. Very, very important. That first milk has lots of antibodies in it, and it does line the intestines, gets baby ready for digestion. So very, very important. Let's see, second night syndrome is a real thing. So day 1, baby is nice and calm, just straight out of the womb. And then day 2, doctors, nurses, poking, prodding, visitors becomes very overwhelming to baby. So do expect, baby to be a little overstimulated. And so a nice quiet space, not a lot of people, just, baby on your chest can really calm baby. And that's usually when you get discharged too, usually around that second night. So, and by then you're at home and, you're like, where's there's not lactation here. So, definitely, you can definitely reach out to us at WIC, or usually most hospitals will have, lactation support after hours. And then really calming baby, skin to skin. Offer unlimited time at the breast. And this is a really good picture because you can see it looks like she probably started off at the chin. So rubbing your nipple onto the baby's chin is going to open up them rooting reflexes and get that mouth nice and wide open. And waiting for that deep sleep. So if you start feeding baby and baby falls asleep at the breast and you put baby down, there might be a chance that baby will wake. So if you wait until baby's in a little bit of a deeper sleep, that can take, 20 minutes, half hour or so, and then lay baby down, they're more apt to stay asleep. So just a little pro tip there. Nice quiet room. Hands-free. And you see how this baby isn't wearing any mittens, anything to kind of hinder that hand movement. Babies use their hand to feel the breast and cushion and kind of catch their bearings. Where are they at? And so not using mittens, babies can, practice suckling on their own fingers like this baby here. Or, you want them to be able to feel where they're at and feel the breast and see where it's at. Definitely they use their hands just like we use ours. Get up and move around with baby. Yeah, for sure. Let's see. And then nourish. So this is one of my favorite parts too, that they talk about. How important a good latch is. Definitely belly to belly is a good rule of thumb. You want baby's belly towards your belly, and what that does is keep the trachea nice and straight for good, easy swallowing, and hold baby in, keep baby real close, support the back of the neck there, and you see how the baby's chin is flush against mom's breast there. Nose to nipple. What this does is wake baby. If you hand express a little bit of milk out, they can smell that milk, they can taste that milk, and you can even, take your nipple to the baby's chin, and that will get them to open up really wide. And that's what you aim for. If you can catch a good yawn, baby in a, a little bit of a, cry, pop as much of that areola in the mouth as possible. The deeper the latch, the more milk a baby will be able to pull, and the less, pain you will feel. We don't want you feeling, much pain. That first, 30 seconds or so, you might feel a little, tender is the best word I can use to describe it. Your breasts are ultra sensitive in the beginning so that you can really respond to baby. So they might feel tender, but that should subside within, 30 seconds or so. And definitely just watch for a good latch. And every time at the breast is that learning experience. So for sure. And trying different positions, do what's comfortable for you, comfortable for baby, and then doing different positions, especially in the beginning of breastfeeding, can put the mouth on a different part of the breast. So baby's not suckling on the same exact spot to kind of give that spot a rest. And this is a cross cradle. And laid back breastfeeding, which is really good. It's kind of gravity working with you. So if you're in that laid back position, baby is just on top of your chest and they can just submerge themselves into your breast, and then your nipples not being pulled. So laid back can be a really good breastfeeding position. And nope. Let's see, reasons to breastfeed. Yeah, there's a lot of reasons to breastfeed for sure. The benefits are enormous. It really is. There is living cells inside that breast milk. And so they change as baby grows. Definitely the milk changes to kind of, the different seasons of a baby's life where, formula might stay the exact same, and it has the same exact food for, 0 to that 12 months. They're getting that same milk. Breastfeeding, no, the milk definitely changes as baby grows. And so breastfeeding exclusively for the first 6 months, there's tons and tons of benefits. And even after that 6-month mark, with all my kids, I went significantly longer with each of them. And so protect breastfeeding. No pacifier bottles at first. And the reason being is you want baby to learn to latch. It is a learned technique, and it does take some work. And, with bottles, the milk comes out a little bit easier. And at the breast, they really do have to work for it. So it is important, to keep baby at breast. And then avoid the bottles or pacifiers. If you are in the hospital, you can talk to the lactation there to see, you could hand express a little milk and put it in a spoon and give it to baby that way. Definitely every drop does count. Baby's belly is really small, the first day, my little belly balls, day 1, really, really small, a little bit bigger than a model. Day 3, belly is about the size of a ping pong ball there, and day 10, a large egg. So the breast milk is really easily digested. So the breast milk goes in, comes out, and then babies are hungry again. So, and as baby's belly grows, so does your milk. So usually your milk comes into volume around 3 to 5 days, give or take. And so that's where you see that belly start to grow to kind of match baby. So definitely important. And how milk works. So like I said, the first 2 weeks is your lactogenesis stage, and that's really where that supply is determined. So lots of stimulation in those couple of weeks will make for that ample milk supply. Too much stimulation can be an oversupply, or too little, not enough milk. So really just, using baby to kind of, you want to mimic, them feeding patterns and have baby at breast. So your body knows, your exact feeding patterns. And then your milk factories inside the breast, definitely what it looks like there. So let me see if I can pull this up. And so one of the things I think is a cool concept is the colostrum is very power packed. So think about it as like a juice concentrate, and once that milk comes into volume, you're just adding that water, and that's usually between that 3 to 5 day mark. So the first couple days, you're not going to see a whole lot. Don't think, oh, I have no milk. It's going to come into volume, but milk that you are making is very concentrated, just exactly what baby needs and matches baby's belly. So do know, definitely. And then we already kind of went over the belly balls there. Is my presentation. I hope, you learned some good stuff. If you have any questions, if I'm texting you this video, I will put in my number to contact me. So have a great day, and we will see you soon. Baby will be here in no time, and enjoy that time with baby for sure.